Welcome everyone. We'll talk about counseling and coping in disaster situation. What can be done and how do we help each other post the disaster in this presentation. Yes, after a disaster, everybody is stressed out. Stressed out is uh, is where people are not able to understand what is the right way to carry life forward. Are they reacting, behaving in a perfect fashion or not? As we talk about it, let's say Sile says is an oversimplified concept of stress. Richard Lazarus, on the other thing, is new approaches of understanding stress. Stress is all about relationship between the person and environment, is what I have been trying to tell it to you. Post disaster, a person is not able to react, probably understand what behavior that they should be exhibiting, which should be in tune with the situation. They are aloof with the environment. They are not in sync with the situation, and as a result we call that person is under stress. So it might be taxing, it might exceed his or other resources, endangering his or her well-being, is what the outcome is all about it. So component, yes, there's an antecedent, the disaster impact, there's a stress, we have an antecedent, we have a stress, and how the person react to these situation, this environment, the behavior is what coping mechanism is all about it. The adaptation is where you come up. Can a person become a normal person post the disaster? To a certain extent, yes. Many a person might not be able to come to the reality of the situation. So as a result, the adaptation might be a little bit different. They might be a, so let's say if somebody has been just experienced a fire in their building, in a high-rise building, and wherein barring few, everybody got churned down. Absolutely, everybody is no longer there. Now look at the person who is actually alive. Probably from things might get normal after a few years. He or she might be doing good in his life, but a sense of fear will always lurk in his or her mind with respect to fire, and that is what adaptation is all about it. So antecedents to stress is person-environment relationship. We're talking about values. We're talking about commitment. We have personality behavior pattern. Did I say about the fire in the building and the person after the disaster? And when I say after disaster, it might be 2, 3, 4, 5 years after disaster. The person might not be very comfortable with the fire nearby, no matter how small the fire is all about it. It can be just a bonfire, for example, but the person might not be comfortable. And similarly, certain things I've just given you or cited an example to you to make you understand what exactly I wanted to point out. Similarly, for environment is the social network, the social support, the demand, the constraint, the socio-cultural factors, and the life event that comes around it. So everything has impact. The social network, a person who is all by himself or all by herself, a loner in the society, might not be able to come to reality post a disaster because he or she will not be able to relate to anything, and there are no one close to him with whom he or she can share his or her point of view. So social network is very support. Social support is very required. So demand of the new lifestyle that we all are leading is something which is real. We need to take into account the constant there about the life events is when what is the age of a person, the demographic profile, how successful he is, what is expected in a normal day's life, as the case might be. How do we go across it is what we will be talking around, and that is what is to be done every now and then. So antecedents to stress is cognitive appraisal. Let us talk about the mind factor, what happens in your brain. Now, the importance of the event is very pertinent. In case, if the let us continue with the old example of a fire in a building. Let's say the fire in the building happened, and that was a normal day in your life. It was like any other day. It happened, and it had a catastrophic impact. No doubt about it. We are not changing anything else. But let us come to a similar situation, but I would love to change the importance of the event. let's say there's this fire in your building, the catastrophic event impact that did happen, but on that day it was a very important day for you. Perhaps it was your wedding anniversary, perhaps it's your birthday, perhaps you got a promotion, perhaps anything that was having a sizable impact as far as you as a person is concerned. So that makes the event much more memorable or much more fearful, perhaps, and even maybe extremely stressful to one and probably not to another. So, if for a person who had a normal day and the fire happened, might not be as stressful, but that fire happened on somebody's birthday, anniversary, or a special event that he or she might be planning for, and this happened, probably it's much more stressful. So, meaning depends on the risk benefit, and that is what we would love to go around it. Primary appraisal is relevant goals, consistent with values, personal commitment. The secondary appraisal is all about blaming, all about giving credit, all about accusing, all about coping with potential future expectation, as the case might be. Stress is initiated, remember, by an unfortunate, unfavorable, unwanted person environment relationship. That is meaningful in terms of risk or benefit to that person well being. The more committed to the goal, the greater the vulnerability to stress is all about it. Stress response, psychological response is sympathetic response, immune system functioning affected negatively. Over a period of time, biological response to the stress compromises a person's health status. That is what physiological. You are impacted physically. Perhaps you might be stammering, perhaps you might be sweating, perhaps you might lose your temper. So these are biological response that goes around, which is physically evident. Emotional is where your psychophysiological reaction, your emotions, your stress out, your coping mechanism is completely different. You either you are challenged or you are threatened, or you might be in your shell. You would not like to venture out, take risk. Emotions, negative emotions occur when there is a threat. Anger, fright, anxiety, guilt, shame. Next is all about sadness, envy, jealousy, and disgust. And I'm trying to give you negative implications of emotions, examples of emotions as far as anger, fright, anxiety, guilt, shame, sadness, envy, jealous, disgust is concerned. Positive emotion is a movement toward attainment of a goal. It is all about happiness, pride, relief, and love. Borderline emotions is ambiguous, hope, compassion, empathy, sympathy, and contentment, as the case might be. Non emotion doesn't fit into a category. Probably we are talking about a lack of confidence or excess of confidence, lack of adulation, honest, confusion, excitement, you name it, and we have it. So, yes, emotions can be both positive and negative. There might be emotions which might be borderline cases, and then there might be emotions which we will not be able to classify as certain things. So coping mechanism process is all about managing the demand and the emotion. The problem focused coping changes the relationship between the environment and the person. Emotion focused coping is what we looking into it. As per the situation, can you give appropriate reaction? This is what coping mechanism. If you're not able to give appropriate reaction, probably you are still not in the grasp in the present situation. You are in the grasp on the hold of the past situation that you have already encountered. Adaptation is what we are looking into it. How a person can adapt, survive, and probably flourish and continue with his healthy life that he has, a happy life. Affects three areas: health, psychological well-being, and social functioning. Counseling management may not have a disaster management, may be an adjustment disorder. The goal is to recognize stressful events, to strengthen positive coping skills, as the case might be, is what we are talking around here. The goal is to recognize a stressful event, to strengthen the positive coping skills, is what we are looking around. Let us talk about counseling mechanism and how does it help. So if I'm sweating, probably if I'm sweating out and a biological thing responses, why am I responding? What went wrong? If there is a itch in my skin and every time I get into a situation I'm itching. If you think my hair is getting whitened and the color of the hair is changing, or what it is all about it. So you can understand you are going through a stress. You need to understand reviewing the system, physical functioning, and probably a proper medication will help you to go around here. People might be frequenting the restrooms just because they are stressed out. Now, these are required for counseling. These are biological manifestation of stress which needs to be taken into account. Similarly, for psychological, out of your emotions, security of responses is what is required. Then comes the social recent life changes. Social network and support. We are talking about size, we are talking about function, we are talking about reciprocity and interconnectedness. If that is what we are looking into it, social social network and support, I thought as the size increases about the social support, probably the person might come back to normalcy. But if the size is zero or doesn't exist, the person is in isolation, probably it becomes very difficult for the person to come to the environment, understand the situation of the reality. So size matters, functions matter, reciprocity matters, interconnectedness matters. Now, how do we diagnose a person who has undergone a disaster? Probably we need to understand his or her feeling as in terms of anxiety, or the fact that he or she is feeling helplessness or powerlessness, the fear, the fatigue that a person is displaying, the low self-esteem, the ineffective coping, family coping, altered role performances, as the case might be. If we go around it, what happens? When will it go around? Intervention is biological. Nutrition and exercises, yes. If there are people, probably I'm frequenting the restrooms, probably I'm sweating, probably the color of my hair is going around, probably there's a itching in my skin every now and then. So we should take proper nutrition, proper exercise. Remember, our glands are not functioning well, ensuring them that they are functioning well. Psychological is the network indicator centers. If we go around it, if we understand for what reasons, what are the cause and effect for everything that needs to be done for. Social is increasing our community presence, participating in community programs per se. Crisis, stressful experiences for coping mechanism felt definitely yes. Precipitating event is very rare, very unusual. Similar event usually do not happen more than twice or thrice in a lifetime. Time limited is 4 to 6 weeks. No such thing as chronic crisis. Believe me or not, this is something which I believe. If you are in a difficult situation, believe it or not, that difficult situation is only going to make you mature. The difficult situation is only enabling to help to come cope with much more difficult situation later point of time. And no wonder, no matter what the difficult situation is there, that situation is not going to last long. So it is, there is a phase that it will pass down. So there is nothing called a chronic crisis. There is a turning point in life and can develop acute stress disorder. So, what is the crisis process? An event is perceived as threat, or probably usual coping mechanism does not work. There is a tension that builds up. The person get all hyped out, attempts to cope are successful or probably unsuccessful. Whether the person comes out in flying colors or probably not so in flying colors is what we are looking around here. So types of crisis, it can be incremental or development. It can be situational. Let's say you lose somebody very close nearby, near to you, perhaps one of your family members. So there's a bereavement, or you find there was a person who you were adulated all about. You believed in his or her dreams, probably the way he or she carried his or her life, and suddenly some mishap occurs, and you are in shock, in disbelief. Acute mourning, absolutely yes. We have an intense feeling, social withdrawal, identification with that deceased, the person who has just departed. Resolutions, dysfunctional grieving, as the case might be, is what we are looking forward to. Counseling management is all about assessment. Counseling diagnosis is all about grieving, post traumatic responses, relocation stress, as the case might be. And that is what we are talking. Intervention is assist in confronting reality, encourage expression of feelings, encourage persons to focus on one thing at a time, as on when on basis. Now, these are the intervention that carries on. So yes, we require interventions. Yes, we require counseling. Yes, we require community participation. We should go through the emotions of grieving, definitely, yes, but we should also come out of it. We should not hang on to the grief for beyond a certain point of time. So there has to be a post-traumatic response, a relocation stress. We need to understand the reality, and the reality should dawn upon us sooner than later. Intervention is having false reassurances, clarifying fantasies with fact. Please do not have uh, lofty fantasies, lofty goals. Be realistic, link with your community resources. Psychopharmacologic, help re-establish the network support. That is what is most important. Then we should be party to a community intervention helps in the longest form of run. Telephone hotlines, residential crisis services, as the case might be. Disaster is sudden, overwhelming, catastrophic events that causes great damage, destruction, mass casualties, and human suffering. Often, more often than not, been caused by nature, let's say earthquake, or humans, let's say there's a chemical spillage, there's a terrorist attack. This is what disaster is all about. It is a sudden, catastrophic event. You have not prepared for it. And suddenly, in a split of a second, you are put in a situation where you are not able to cope it up. It is beyond your means to cope along. So, types of victims who may not survive the disaster or who may. Let us focus on the people who may survive, because with them it becomes it is essential that they come to a normal life, back to the societal norms. Victims who survives are going to experience depression, are going to have difficulties in coping up with the situation. The PTSD, the post-traumatic stress syndrome would come into it. Now this is what we are talking around. The rescuers often suffer psychological effects. In fact, I can say anybody who's gone to a hazardous situation, disaster situation, should always will have a mark of stress left in their mind. So, counseling management, let's say the assessment should be physical reaction, let's say tachycardia, etc. Panic without regard to personal safety, perhaps without regard to personal safety, always a sense of urgency. Intervention is treat physical reactions, provide reassurances, maintain safety is what we look forward to. The psychological domain, we need to study the person, observe for depression, observe for errant behavior, observe uh, for leading a normal life or not. If not, if not, then you should make an intervention. Determine how patient normally responds to stress. Interventions might be therapeutic communication, apply principles of stress and coping model, refer to a mental health clinic, and believe me or not, this helps over a period of time. The mere fact that you are stressed, the mere fact that you acknowledge that you are stressed, in fact, is half the battle that is won. The social domain, if we go around, is absolutely yes, the capabilities of individuals and community to respond in a supportive way, mutually exclusive to each other's, mutually inclusive of each other's, which is the right way to go around it. It should be always inclusive. Interaction of the news media, women exhibit higher level of stress. Violence may become a problem. Intervention, teach individual about community resources, support family system, and refer to community resources as the case might be. If and when we can go across with it. With this, I come to an end of this presentation. Thank you for watching this video till the very end.